for having reported and giving us the latest updates on what the situation is. Also on the telecast with me is Dr. PSV Rao. Thank you so much for joining us on the telecast. And my first question, that while this virus has revived and is infecting not just China, but United States has also witnessed a number of cases. India has seen now 7 cases emerge. How ready are we in being able to have a vaccine prepared to ensure that any mutated forms of this virus can be contained?
Good evening, Megha, and all your viewers. See, this is not the only respiratory virus, nor is corona the only respiratory virus. We have a test panel in which 22 different respiratory viruses can be checked. So you can't be now having vaccine for everything, and nor can you be chasing all these viruses. These viruses have existed for a long time. It is only when we start testing that we realize that, oh, there are 2 cases in Bangalore and there are some other cases here and there. These cases were already there. These haven't come recently from China. None of them have shown to have any contacts who have had any visit to China, or someone who has come from China and visited them. And these are all, most of them are all infants, young children. This virus has been known for many years to infect children, especially infants, that is below 1 year, and also children above 5 years. And most adults have already been exposed in their childhood to this virus, and hence don't show any of the infection. They can be carriers. But the infants also recover quickly, and they don't have any serious illness, and this is why we have not been trying to develop vaccines and chase them around.
Okay, but now, is our medical system equipped, like I asked you before, if there are mutations of this virus which could be more dangerous than the original one itself?
If something comes out more dangerous, then our vaccine efforts will be put in place, and we would develop vaccines for it. Like the influenza virus is something which is updated every 6 months, as I mentioned before also. In December, January, February, when it is winter in the northern hemisphere, all these upper respiratory infections which present like flu, like symptoms, are prevalent during that time in the north hemisphere, and we have the vaccine for influenza virus of the variant which is prevalent in each winter. Same way, when there is winter in the southern hemisphere, which is in June, July time, then we have for the whatever is the present prevalent vaccine virus there, we have vaccine for the influenza virus there. Now, coronavirus, especially the one which was developed in the Wuhan lab, proved to be very deadly because it was designed to become deadly for the human beings. Every respiratory virus is not deadly. So we needn't panic. And if we start testing everyone who has a cough and cold, we will find that one of these multiple viruses is there.
Okay.
And we have
also
testing for 22 viruses.
Talking about, the virus that first originated, was first detected, the HMPV virus was back in 2001 in Netherlands. Why is it that after so many years, this virus has re-emerged?
It has always been there, Megha. We don't bother to see during the winter time when there is so many people having cough and cold. Do you start testing each one as to what virus they have? We don't. And even before it was discovered in Netherlands, this virus would have existed. We wouldn't have methods and methodology to identify it and test for it. And God knows how many more viruses are there about which we are not aware. And as these tests are developed to discover and to identify these viruses, the more the number of tests. Like I said, we already here have a test panel available in all our hospitals here, which tests for 22 different respiratory viruses. So in another few years, this 22 number will also increase as more viruses are identified. And
Right.
not all of them will cause deadly infections like what Corona did.
Okay.
And that is why the
So,
fear is not there.
do you think there has been quite an alarm that has been raised simply because there have been increased number of cases that have been detected in China? Had this virus been detected in any other part of the country, the concern would not have been as serious?
Yes, Mega, there are multiple reasons for it. One, the last four pandemics have all originated in China, including the influenza pandemic, the SARS pandemic, the COVID-19 pandemic. They have all started in December during the winter in China. They have all been spread the whole around the world during the Chinese New Year, which happens to be on 29th of January this year. It is always in January. And the Chinese authorities have always suppressed the whole matter. They have never been transparent. That is the major reason why everyone is suspicious of anything which goes in China. So if they report 4 cases, we wonder if it is 4,000 cases or 40,000 cases. And if they say there are 4 different viruses, we are not sure if there is one specific virus creating it, and they are just trying to suppress it. And remember, during the COVID times, they even suppressed the doctor who was the first one to report that there was something MS. There was something. There was a new kind of virus, and the poor chap is no more also. So this is the problem with China.
Okay, so then the World Health Organization, the US authorities, global health organizations at this point of time are urging China to be more transparent and provide information about any outbreak of influenza or influenza-like diseases like this particular virus that has come to fore. How much of a trust factor can be built on China at in this regard at this stage? And again, do you think even if the virus were to spread and across the globe, the reason for concern and raising alarm should not be there, because it is not as strong and potent as COVID was?
Yes, Mega. What I feel will going to happen is WHO, the world organizations, including the Indian government, are all now pressing China, saying that please tell us what is happening. Now, see, because of their past, we don't trust them, and I think everyone is going to keep a watch on what is going on there till the Chinese New Year. And if things go from bad to worse in China, you can be rest assured that everyone is going to start putting travel restrictions, and many of them would have already started surveillance of people who are coming from China. And remember, last time we didn't immediately get from China, we got it via other nations where the virus spread first before it reached India. So these surveillances will start happening more and more as days goes by. And if things get worse in China, I'm sure there will be travel restrictions very quickly put in place and quarantine facilities made available.
Okay, all right. Thank you, Dr. Rao, for joining me on the telecast and giving